you have finished the abdomen and the liver and all that good stuff. You're not going to do this part of the body, the vaginal area or anything like that, okay? Now, as the patient is lying here, any of these you can do in any order you like, okay? First of all, I want you to raise your leg up against my hand and just kind of, I'm going to push down, okay? And then let's go to the other side. We're going to push down. We're checking for strength, okay? We can have her go here, raise it up, and push. Good. Again, up, push. Great. Okay, take this. I want you to bring it back. Push against my hand. Oh, you're strong, Peggy. Gee whiz, lady. Okay, very good. Now we got everything going one way, right? All right. Now we can have her at the same time push out, both legs out. See what's happening here? Another way. Push in. Okay. Push up. And down. So therefore, we can do it here. We can do it down here at the same time, and have her go down, have her go out to the side, have her come in, right? Okay. And we can do it up here and here. Okay. So keep that in mind. One side compared to the other. Don't forget that since we're down here, we've already checked the temperature, because one thing we want to know when we look at her body, we want to see that everything is symmetrical before we start touching anything. That there is no heat, no swelling, nothing like that, no pain or anything like that going on. Nothing happening there, Peggy? Okay. She didn't have any swollen ankles or anything. She did not have this polish on. We can go ahead and check for capillary refill. Okay. We can have her push the toes in and out like we did the hands. Could we not? Okay. So all of this is good to go. Okay. Now, in order to do the Thomas test, no, let's do some other things. I want you to raise this leg up for me, just one leg. Raise it off the table. Bring it out this way. We're checking the hip here. Take it all the way back across. Any pain? Okay, bring it back.
Down there.
Down there. Okay, and lay it down. Okay, with the other one, take it out. Very good. Bring it all the way across. See how that, okay, with a hip? Okay, take it down. Very good. Okay. That was easy enough, right? Now, if we wanted to check her glutes and strength and all of that, we could have her take this leg up.
This way?
Just bring it straight up, and then take it out like we had before, and then just kind of come up to the edge of the table a little bit. Just kind of drop it. Just kind of drop it off the table. Is that pulling anywhere?
No.
Okay, because we're trying to see if she has any strains or anything going on here with her iliopsoas muscles, or anything happening here with the femur. Okay, bring it up. And then let's go to the other side. Okay, you take it back as far as you can. Nothing's going on there. Okay, now bring it back up and then come back with it. Okay. Now, to do the Thomas test, have you come up higher on the table. Because we want to get away from this thing. Okay. This time, I want you to raise your leg up, but just barely off the bed. Just one leg. Now what I'm examining is not this leg that's off the bed. I'm looking to see if this leg raises up at all. The one that is on the bed. Okay? If there is some contracture or something going on up here, she would not be able to keep this leg straight down on the bed. Okay, that's the Thomas test. Okay, let's have you raise the other just a little bit off the table. That puts a lot of strain and pull all through here. Does it not? Lift it up just a little? Okay, and then put it down. Very good. Okay. Now, in order to do the drawer test, I want you to come over just a little bit. Put this foot on the bed. Very good. Okay. Now I'm going to sit on your foot. And what I will do then next is that I have her legs are bent just enough where I can get my hands behind here. And I'm going to put a thumb on either side of her patella. And I'm going to pull like a drawer and push. Pull and push. Okay? Now, as we know that her ACL is from the femur all the way down to the, which bone? Is it the tibia? Okay. And there is a posterior ligament as well, and it's going all the way, but once again, it's still connecting the femur down to the tibia as well, okay? So we're trying to see if we can move this. We're not so much concerned about the collateral ligaments, but yet if this bone wasn't connected to this bone, we'd have a problem with the collateral, okay? All right, so we're going to sit here, and we're going to pull and push. And we're trying to see if we can move this knee out at all. And if there's any movement in this knee with us pulling and pushing. You got it? Okay. Now we have her go to the other side. One side compared to the other. Now notice, examiners, that you have to sit in a certain way so that you have this foot on the floor. Right? Okay. Now, here we go. We're here, and we're back. Here, and we're back. Right? Now you can see if all this wasn't attached the way it was supposed to be, there'd be some movement here. Okay? And a lot of pain. Okay? Now, good deal.
Dr. Griffith,
Mm-hmm.
could we do these when we are checking when she dangles her leg because she's on the edge already? So do both things
You
at one
could.
time?
Yeah, you could. Okay, let's do what's called the Apley test. Now, for this one, excuse me, we're going to have our patient turn on her stomach. And when she turns over, this may not be a test that you would do for an elderly person. Notice how my hand is right here. I'm making sure that she doesn't roll off the bed while she's turning over.
Do you want the arms down or up?
Oh, it doesn't matter. I'm down here. Okay. That area where she's talking about checking behind in the popliteal, and if you need to get your pulse or check for nodes and all, you can still do it here. But the whole idea here is that you're going to take the bottom of her knee, and you're going to press it into the bed. You're going to take her foot like this, and you will turn. Okay? Okay? So we take it here, and we turn, and we turn. Turn, and turn. Okay, what's happening here? What could be sliding and moving? What happens to the meniscus? Remember how that kind of sits down in there? Okay. You wouldn't want bone on bone or anything like that. You don't have to go around the table. Okay? Knee's going to be pushed down into the bed. So you kind of go, I'm exaggerating. Okay, here. And here. Okay? Does that hurt you at all? Okay, good. Now, let's help her come back over. Roll over. There you go. Now, ACLs, all that good stuff. The McMurray. Okay. Check my notes there for me. Sound like my aunt. You see the little notes at the bottom with the McMurray and the Apley and all of that?
Apley is prone meniscal
We did that.
tear, knee to table, Murray's prone meniscus, drawer.
McMurray, okay, we haven't did the McMurray yet. Okay, but that's what we're going to do. Now, we're going to take your, and make like an L with this foot. Okay? You want to take your fingers right here. Put it on either side. Okay? Now, I'm going to do a twisting motion. When this foot goes this way, the heel goes this way, I want the knee to come the opposite way. So it's essentially as if I took her sweater and you know when you wring something out, you're going one direction and the other. Okay. Now the whole idea is that we're going to, oh well, I won't put it that way. Okay. So watch. She's here. We're going to lower this leg. If this person was having some difficulty with tearing and all, you would not be able to lower this leg. Okay. So we're going to twist one way. So I'm going to start twisting. I'll go this way. Okay. And then we'll go this way. And we're down. Got a little popping, but that's okay. I can feel it under my finger, but that's not bad. Okay. Notice I brought her back up. I didn't let go. Because I got to remember I got to go the opposite direction now. And I lower her. Okay. Got it? Okay. So we come here again. We're going to make it like an L. We're going to twist one way and then the other. And we take her down. You bring her back up. Okay, we go this way. And we take her down. Can you do it? Okay.
And which one was that again?
This is the McMurray. Okay? Now, the McMurray is done a lot. All right? Another test you can do, if you want to check for placement and any kind of problems with the groin area or whatever like this, okay? You can have her just kind of turn her foot like this. And then you can kind of push up, down, whatever you need to do, because all that is pulling through here and down through here through the groin area as well, okay? If you still needed to check for arterial, for femoral artery and veins and any kind of nodes and all like this, while you have the patient in this area, because you have this area right in front of you, you can go ahead and check this area now at this point, if you haven't done that already, right? Okay. And of course, if you do one side, you have to do the other. Okay, and you check. And you want to push, do anything you can to see if you can elicit any kind of pain from it. Okay? So, anything else we need to do?
Ballottment.
Oh, the ballottment's fun. Okay, this one. And you can do this one while the patient's sitting up too. You do a little milking. You kind of milk down. And the patella pouch that's right through here, you're looking to try to determine if there's any fluid in there. Also, what you will do is that you will do it, you can do what's called the bulge test. You don't milk down, you milk up with the bulge test, okay? On the medial side. And the whole idea is as you're milking up, if there's any fluid here, you'll put your hand over here on this side of the knee, the opposite side. And when you let go, of course, the fluid is going to come down into this little area that you just removed everything, right? If there's fluid. So you milk, leave some pressure there. If there's fluid, it's probably came over on this side. And now you're looking to see if there's a wave that comes across of the fluid when you let go of this hand here. You understand what I'm saying? Okay. Milk, milk, hold, displace it. Put your finger here. It should have came over here. Okay, bulging out a little bit. And then you let go a little bit. And if there's fluid, you'll see it underneath where you let go. Okay? All right. Another way to do it, where you try to fill up the pouch.
That's in the
That was the bulge test, this one is.
Yeah.
The ballottment is this way. You go down like this. The whole idea now is that if there was any fluid in this pouch, it's been moved down and would bulge on either side. But what you can do is push the patella just a tad, and when you let go of this hand up here, push. If there's fluid there, and you've displaced the patella will float, and the fluid will come back into the area that you've closed off. All right? So you've got everything out of the pouch. You push up on the patella, and you let go to see if there's fluid. Okay? Now, of course, you're going to have people with extreme fluid. There's ways that you can go around. You can move this around and all kinds of stuff to determine if there's fluid. Okay? So there's lots of things, many, many different tests you can do, but you will be responsible for, even though I showed you the bulge, you're going to be responsible for the ballottment test, the McMurray, the Apley, the drawer test, and the Thomas we did earlier, and the Trendelenburg was when our patient was standing up and we were behind her, and we asked her to stand on one foot and then on the other, right? Can you do it? Okay. Get with your partner real quick. Let's see if you can. I'll call them out.